Hello, good morning everyone. I am Luana Mauricio and I will present a thesis on the following subject. Pressure injuries indexes of patients interned in intensive care units at Brazilian university hospitals between 2015 2020. The work was carried out by the authors, Luana Mauricio and Marina Guarnieri. Both are medical students at the 9 de Julho University, and by the supervisor, Luz Marina Gonçalves de Araújo Oliveira, medicine professor at the 9 de Julho University, an institution located in São Paulo, Brazil. Pressure injury is a skin injury resulting from prolonged pressure or friction in a particular region of one's body, which is also usually located above a bone prominence. The patients who are most at risk of developing these types of injuries are the ones who long stay in the same position, have advanced age, systemic arterial hypertension, diabetes mellitus, as well as other comorbidities that affect circulation and worrying nutritional status, obesity, and malnutrition. So these injuries have a high incidence and prevalence in intensive care units and are predominant causes of morbidity and mortality. Prevention can be achieved through the following research. One is the Braden scale, and other is the difficultiness staging from 1 to 4 of the National Pressure Ulcer Advisory Panel. Other is change the acuity position of the patient in bed. Also training the team responsible for the patient and doing appropriate patient skincare. The first table shows the difficultiness staging from 1 to 4. Stage 1 is intact skin with erythema that does not whiten. Stage 2, the dermis exposure. Stage 3, fat is visible. And stage 4, exposure of the fascia, muscle or tendon, ligament, and cartilage or bone. The second table is the Braden scale, which scores the patient's activity, sensitivity, skin moisture, nutrition, mobility, as well as the presence of the friction and shear. The lower the score, the greater the risk of developing the injury. Through the use of this scale, the patient can be taken care of according to the category most affected. So the objective of this study is to evaluate pressure injury indexes in patients admitted to the ICUs of Brazilian university hospitals between the years 2015-2020. Method. Bibliographic review of 20 studies collected from the Cielo, Lilacs, PubMed, and BVSalud databases through keywords pressure injuries, university hospital, intensive care units, ICUs, and Brazil. About the results. The 20 studies analyzed showing an average incidence of a pressure injury of 35.5%. The region most affected was the sacral area. Regarding risk factors, hospitalization for more than 10 days, comorbidities, and low scores on the Braden scale stood out. Significant death rates resulting from complications of pressure injuries were found in 5 studies with rates of 80%, 61.4%, 53.85%, and 52.94%, 39%. The study of Pacha 2018 reported septic shock as the main cause of death due to complicated pressure injury. This is the table produced by the author that contains the main results of the 20 studies analyzed. And this table with the incidence and prevalence rates of injuries according to the total number of patients admitted to the ICU and the main risk factors present in the affected patients, also the region of the body most affected, and average hospitalization time of the patients who develop pressure injury, and also the number of deaths resulting from complications of these injuries. So, between the years 2015 and 2020, pressure injuries rates were high in patients hospitalized in Brazilian ICUs because they are mostly ill with prolonged hospital stays. About the risk factors, the development of these lesions predominate in patients with previous comorbidities and with low indexes on the Braden scale. Therefore, it's essential to use the Braden scale to change the decubitus position in bed for better prevention and thus to reduce the length of hospital stays and the risk of death from the complications of pressure injury. Below are the references used to sustain the thesis. Thank you so much for your attention.